Medicare open enrollment is here. Are you ready? We're breaking down what to review, what to avoid, and how to make smart choices. That's next on the Compounding Change podcast.
This is the Compounding Change podcast, sharing stories of small but meaningful changes that compound into amazing impact. Brought to you by Shannon Davis and daviscompoundingchange.com. Change happens fast. Take advantage. Discussions on this show should not be construed as specific recommendations or investment advice. Always consult with your investment professional before making important investment decisions. Securities offered through Cambridge Investment Research Incorporated, a registered broker-dealer member FINRA SIPC. Investment advisory services are offered through Retirement Plan Advisors LLC, a federally registered investment advisor. Cambridge Investment Research and Retirement Planning Advisors are not related to daviscompoundingchange.com or this podcast. Now, here's your host, Shannon Davis.
Hey everyone, welcome back to Compounding Change, the podcast where small steps lead to big transformations. Today we're continuing a conversation we started earlier this year that really struck a chord: Medicare. And now, open enrollment's just around the corner. If you're 65 or older, or helping a parent or spouse figure this stuff out, the next few weeks are key. It's the window where you can make changes, add coverage, switch plans, and avoid costly mistakes for the year ahead. Back with me today is Amy Terrell, a licensed Medicare agent who brings clarity to what can feel like chaos. Last time we covered the basics: what Medicare is, how and when to enroll, and how it ties to your bigger retirement plan. But today, we're going a little bit deeper. Whether you're retired from the firehouse, recently turned 65, or just staring at a stack of Medicare mail, wondering what's next, this one's for you. Amy, welcome back.
Thank you so much for having me.
Thank you. You've already helped so many of my listeners and clients cut through the confusion. So how are you feeling going into this time of year, the open enrollment?
I'm feeling great. This is my favorite time of year. This is the time I get to help so many different people assess their Medicare plans and make sure they're on the correct plan. So I'm really excited.
Yeah, I'm sure it gets busy, kind of like tax season, right?
Exactly.
So what exactly is open enrollment? So let's start with the basics, Amy.
Sure.
Who's it for? What kinds of changes can someone make during this period? Those types of things.
Okay, open enrollment. It's also called annual election period, AEP. It lasts from October 15th to December 7th. So any of these changes that you make during that time of year, it will be effective January 1st of the following year.
Okay.
So
they couldn't just make it easy, October 15th to December 15th, December 7th. Okay.
Yes. So that's simple as that is. What you can do during this time is you can switch from original Medicare to a Medicare Advantage plan or vice versa. You can change from one Medicare Advantage plan to another. You can enroll. You can drop or switch a prescription drug plan, or simply just review your plan and update any information to make sure that you are on the correct plan. So you wonder why you would do this, every year, but plans change, their premiums, their benefits, provider networks, and maybe your health has even changed. So you really want to do this review to make sure that you're not getting hit with higher costs.
Okay. So this is, technically somebody who's just initial enrolling, it could technically fall in open enrollment, but the difference between open enrollment and initial enrollment, what really are we looking at there?
Okay, so initial enrollment is when you're going to be turning 65. So you're originally signing up for the first time for Medicare. So they give you a 7-month window. So it's 3 months prior to turning 65, the month you turn 65, and 3 months afterwards. So they give you a nice amount of time. I always tell people, I like to sign people up 3 months prior just to be ahead of the game so that when you turn 65 that month, the first of that month, you have Medicare and you're set and ready to go.
Perfect. Right. Yeah. So you could even start kind of filling out paperwork, see what you might be missing type thing.
Yes. So you do that 3 months prior. So there's no way you're not going to have it set for the first of the month that you turn 65.
And if you found you were missing something, you still have those 3 months after as well.
Correct.
So focused on open enrollment, but so what are the most common decisions people should be reviewing during open enrollment? Is it just about changing plans, or is it really more convoluted than that?
Well, it's a little bit of both. Every year, people should get a Medicare review. It's extremely important because the plan that you had 5 years ago is not the same plans of today. So, your doctors, prescription drugs, hospitals, what you're paying per month should be reviewed. It's very
Okay.
important that your doctors and hospitals are in network. Very important. And it's also very important that your prescription drugs are covered because you don't want to have to pay too much money because they're not. So carriers change their plans every year. So you really want to make sure that you're on top of that. And so when you meet with like a consultant like me, I know what all the plans are for the new year. And I know if there's a better plan out there than maybe the plan that you're already on.
Okay. So for someone who's already picked Medicare Advantage last year, but maybe they're not totally happy with it, what should they be thinking about now?
Okay. I see that a lot. So what they should do is I would suggest them trying to find a Medicare consultant and set up a time. Like I'm setting up times already. I'm dates and times now, and it seems like it's far away, but it really isn't that far away. What the person should do is put a list together of their doctors, their hospitals, prescription drugs. Get that all ready so that when they're on the call, they have it ready and available. What else they should have is a list of things that they like about their current plan and things they don't like about their current plan, because that can help the consultant know, what the hot spots are and maybe what a better plan would be for that particular person.
Okay. So this is just like with your employer, ultimately, it's evaluated every year. So it doesn't matter if you're 65 or 85. This is something that people need to be looking at every year to make sure that it's lining up.
Absolutely. Every
Okay.
single year, I think it's thoroughly important that everybody does a review every year, for sure.
So then where do people go wrong this time of year? Like what are some of the biggest missteps you've seen during open enrollment? I'm sure
Okay.
there's a lot.
Yeah, there are a few. Yeah, not getting a Medicare review, just staying with their same plan, assuming everything is just fine. You don't know if your doctors and hospitals are in the network anymore. You don't know that your prescription drugs are going to be covered. So you really have to make sure to know that every year so you don't get surprised.
Okay. So it actually happened to my husband and me. We were dealing with stuff and not Medicare, but with enrolling in work plan, and we were just dealing with so much family stuff. And we thought we'd picked it,
Mm.
but then when we wanted to go to the dentist, whatever, it wasn't. Those doctors and dentists weren't. So we don't know what happened. Did we not press okay? But people do off or I should say, do people often get surprised when their doctor or pharmacy is no longer covered under the plan, like what happened to us?
They sadly do. And that's a shame. And then, that's when I get the phone calls like, what do I do?
But you can't fix that until next year.
Correct.
Mm.
You every year you have, during open enrollment, you are able to make those changes. So the good news is that when you work with a consultant and they put you on a different plan, there is a lot of verification. So that's good. Like I get an email, you get an email. So if one of us don't get an email, I would look into that and make sure. So there's a lot of things that will cover you on that. So we'll know by the end of open enrollment if you are or are not on that plan, and we'll make sure that we get you on that plan.
Okay. Well, I can't help but I'll always bring this back around, right, to public safety crowd, the firefighters, the police officers, public sector employees. Many of them actually retire with access to healthcare through maybe a spouse, or some even do reemployment. So how does that play into Medicare during open enrollment? Is that even a, I mean, do you pick either or can they have both employer coverage and Medicare?
Okay, well, this group of people are no different than the rest of the group when it comes to Medicare. They should also get a Medicare assessment. So there's no reason, why they shouldn't. They should also too, whether or not they have employer coverage or their spouse does, it doesn't hurt to take a look at it and see, like, compare that to the Medicare. So, make sure, hey, maybe this would be a great plan for you, or that's a great plan you're already on, but it's definitely worth a look.
Okay.
And also, to answer your other question, you can be on both employer insurance and Medicare. Uh,
Okay.
it gets a little more it gets a little more complicated than that, but the reality is you can. It depends. Like if your employer has 20 or more employees, then all of a sudden your employer coverage is the primary, Medicare is secondary. If there's less than 20 employees, then Medicare becomes the primary, and you're probably going to need to get your Part A and Part B. But that's something that when you're going down that road, I would assist with, and we would make sure, talk to HR, make sure what's credible and how many employees do you have and what route we should go. Everybody's a little bit different. Companies are a little bit different. So that's kind of like the bridge you cross when you get to it.
Okay. Interesting. So it's kind of like my standard response to people. It depends,
It depends.
right?
Everybody's a little
It does
different.
depend,
And
right?
with Medicare is very individual. It's what plan you may be on may not be the plan that your neighbor or your spouse is on, because everybody's different. Everybody sees different doctors and has different things that they need. So
Exactly. Like I always say about the firehouses. I mean, there's a lot of conversation that goes on there, but you can't necessarily compare it to what your brothers and sisters in the firehouse have,
it's
because
very true.
your situation is different.
You've worked hard to get where you are. But now what? Hi, I'm Jenna Stoliker, a leadership coach who helps people navigate change with intention. So you don't just survive the next chapter, you grow through it. Whether you're stepping into something new or wondering what's next, let's find your next right step. Learn more at jennastoliker.com.
This one's interesting to me because I think that there's more than one choice. But let's talk about drugs.
Sure.
Prescriptions,
All right.
right?
Sure.
I know that Part D plans change year to year. So not that, they're trying to pull the rug out from under us, but changes happen. So how important is it to review your drug coverage, even if everything seems to be working fine now?
I think it's still important to review that, but it's also something you should be keeping an eye on throughout the year. When you go and you get your prescriptions at the pharmacy, just keep an eye on what you're paying. And if it fluctuates too much, there's an issue and you should look into that. But if you don't see any issues or whatnot, it doesn't hurt to have a review just for your prescription drugs. So instead of giving a list of doctors and your hospitals, it would just be giving a list of your prescription drugs. I would put it in the system. I can look at it and see how much would you be paying for these particular drugs. And then the good news is this year for 2026, the max out of pocket for all prescription drugs is 2,100. So 2025, it was 2,000. So it only went up 100. So not bad. So that's the most people will pay out of pocket for drugs. 2 years ago, it was 8,000. So this is considerably better.
That is better. That is better. Well, that and I would think that it would stand to reason that a lot of people change from year to year of what they're taking.
Yes.
So that would be time to look at that. So I'm sure that it's complicated and you simplify it, but how does somebody even go about comparing their Part D options to each other? I mean, I guess like you said, you're pulling up the different drugs and what the coverage is, but is there something more to it than that?
Really, for me, it's just entering into my system, and then it sees all the prescription drugs and it pulls up the plans. And so then I can go over each individual plan and which plan would be better for you. It changes with deductibles, with costs, and coverage. So those are all the things that I look at and see what's the best plan for the client and what they think, how much they want to pay, how much of a deductible they want, and the most important thing is if it's covered, all their prescription drugs. That's very important.
Would that work the same way then if somebody were on either their spouse's coverage and Medicare, or a reemployment situation and Medicare? Does that work the same way with one being primary and secondary, or is that kind of off the table with that? Does
So
only one get covered?
so with the spouses,
Yeah, if they were on two coverages, if they had
yeah, it works
Medicare.
the same way. Yes.
Okay. So it's just whichever one would cover it. So maybe one would cover one drug and one doesn't, potentially.
Potentially.
Okay. So for someone who chose Medicare Advantage last year, is open enrollment a good time to reevaluate whether maybe a supplemental plan might serve them better or vice versa?
It is a good time.
Okay.
Medicare plans change annually, so your health needs may change, your budget may change. You might want more flexibility, but keep in mind you cannot be on a supplement and a Medicare Advantage plan at the same time.
Okay.
So if you are switching from the Medicare Advantage plan to a supplement, most of the time you will have to go through a medical underwriting. So sometimes that's not a big deal for some, and sometimes it is for others. So that's something to keep in mind.
Okay, well that makes me think if somebody has a life change and maybe they need to reconsider their Medicare coverage, like a new diagnosis, move, loss of income, whatever, is that still do they still have to wait for open enrollment?
Well, there are different circumstances. So, like with your employer, if you decide to retire or you lose your employer coverage, you get your own special enrollment period. So you
Okay.
don't have to wait until open enrollment. Uh,
Okay.
Relocation. So if you have to relocate, like just even like a service area, or you're moving to another state, you do get a special enrollment period also.
Okay. So you're not stuck until
No,
October 15th.
they do
Right.
not. They do not stick it to you just because you moved. That
Right.
wouldn't be fair. So yeah,
Right. Ohio to Florida, right? The typical, or
right.
Kentucky or Tennessee. Um, well, so like anything, there's so much noise during this season. You've got the postcards, the TV ads. I don't really watch live TV too much, but that's the joy of Netflix.
Yes.
But but the TV ads, the robocalls, kind of like election time, but it's every year. So for somebody who's feeling overwhelmed, what would be the first step to take right now?
The simple answer is ignore it all. Ignore it all.
Okay.
You have people that they just don't have seniors' best interests at heart. And you
Hmm.
have people calling these seniors left and right, and it's illegal to do that. Whether it's a robocall or an agent calling, like they can't be calling these seniors. So instead of being bombarded, just ignore it. These individual carriers are just trying to get their numbers up, and so
Right.
when they see that 800 number and the people call in, they're not like, oh, let's check your doctors and your hospitals and your prescription drugs. They want you to just sign up and call it a day. And that's not the way things need to be taken care of. So that's why we talk about having these Medicare reviews. It's very important. And when you call these 800 numbers, they're not doing that.
Well, and that's why I love having you as a resource, because I know that I accidentally one time was looking for healthcare. This was years ago, and accidentally I guess I put my age in wrong or did Medicare, and the amount of calls that I got. So I love that I can refer clients to you for that, so that they're not getting inundated, because they're not getting into a system when they talk to you.
Right.
It's just having that conversation with you, right? You don't
Exactly.
Okay. You don't have to plug in their information and
Right.
all of a sudden. Okay.
And the nice thing
So,
is I warn people about these calls and I let them know what's going to happen. So they put me in their caller ID. So when I call, they know they can answer that particular number.
yep. Yep. Well, just like with a financial advisor, I mean, it is scary for people to trust somebody with all of this. So is there a best way to vet an agent, or a resource that they can go to that's trustworthy, and know that somebody's not just trying to sell them the highest commission plan?
Right. And that is scary. And I agree with that. You can get a referral from somebody that you trust, like a financial advisor. You can go on their website. You can ask for reviews. You could ask to
Okay.
talk to a previous client and, hey, can I give this person a call just to see, what you're about? Any good agent will give you that information. They're not going to be nervous about doing that.
Okay. So my key takeaways are open enrollment is October 15th to December 7th. And this is outside of your initial your initial enrollment period when you're in that 65 range, and that everybody should be doing annual reviews just like they're working with an employer. So as you would with your employer, while you're employed, you're doing reviews of your coverage and maybe you're switching plans. The same thing goes with Medicare,
Yes.
correct?
That's absolutely
Okay.
correct.
Awesome. Anything that I'm missing?
I don't think so. You covered it out pretty well.
Yeah. Well, everything that you said is incredibly important information. So I really appreciate you coming back on the show, and you always have a way of turning confusion into clarity, keeping it simple.
Thanks so much.
Yeah, open enrollment doesn't have to feel like a trap, right? With the right information and guidance, it can be empowering. So to our listeners, if you're staring down a mailbox full of Medicare mailers, don't panic. Call Amy, right? Start with your current plan, review your prescriptions, talk to someone you trust, and take time to understand what's changed. If you do want to reach out and talk to Amy, we'll link her contact info in the show notes. And as always, if you have questions about how Medicare connects to your pension, healthcare stipend, or Social Security, I'm here for that part. You don't have to figure it out alone. So if this episode helped you, please share it with a friend or a parent who needs to hear it. And be sure to follow or subscribe so you never miss an episode of Compounding Change. Until next time, take care.
This has been the Compounding Change Podcast with Shannon Davis. If you are a firefighter or first responder, you know that change happens fast. Life changes, finance changes, compounding change. Shannon Davis is a certified retirement counselor who understands the needs of Ohio Association of Professional Firefighters members. Click on daviscompoundingchange.com to learn more. Discussions in this show should not be construed as specific recommendations or investment advice. Always consult with your investment professional before making important investment decisions. Securities offered through Cambridge Investment Research Incorporated, a registered broker-dealer member FINRA SIPC. Investment advisory services are offered through Retirement Plan Advisors LLC, a federally registered investment advisor. Cambridge Investment Research and Retirement Planning Advisors are not related to daviscompoundingchange.com or this podcast. Please note that investment involves risk and no statements made in this recording are indicative of future performance. The Compounding Change Podcast is brought to you by Shannon Davis.